This is a video version of a blog post I did a while back that will give you some exercises to work on prior to having ACL reconstruction surgery. So you're going to want to work on stretching the calf and the hamstring out because both of those muscles cross the back of the knee, and when those muscles get tight they will prevent it from going all the way straight, which is very important pre-surgery and post-surgery. Stretching the quads out, an easy way to do it is laying on your stomach. And something you're going to want to do is mobilize your patella to prevent buildup behind the patella. Heel slides and quad sets are a good range of motion combination to do together for extension and flexion. Put your foot on something slippery and let it slide back without a whole lot of resistance. Bridging is a great way to activate your glutes and hamstrings, and also very safe to work on. Straight leg raising is a pretty standard way to work on hip flexor and quad strength. You want to try and keep that knee as straight as you can. Same thing with the side lying abduction. Keep that knee as straight as possible, and you can get your lateral glutes activated with this exercise. Getting onto your stomach, I suggest putting a towel or a bolster underneath your stomach to take some pressure off your back and just lift your legs straight backwards up off the table. This is how I like to do terminal knee extension. There's no real way to wiggle out of straightening your knee. Long to keep your toe flat on the table there. And then hamstring curls, another range of motion without a whole lot of resistance, so you can get some hamstring activation as well as work on knee flexion. Sitting on the edge of the table, you can do a full arc knee extension. Again, more work for the quads. Not a great exercise, but good in this phase of rehab. Standing up, lifting up the heels and the toes. Lifting the toes will work on dorsiflexion as well as more knee extension, and getting up onto your toes will help strengthen your calves a bit. This is how I like to do gait training for most of my lower extremity patients. I really want you to work on landing on the heel, getting that foot flat, and then passively rolling up onto the ball of the foot. Forward lunges are not as aggressive as they seem, especially if you can hold on to something. And you want to work on that front foot staying flat and that back heel rolling up. And this would be a good way to get some full leg muscle activation, as well as moving sideways in a bit of a crouch. It's a good way to build up your confidence for these types of movements. Squatting, I usually have people start out on a higher box and just work on sitting down onto it and then standing up from there, and then you can progress from there. Partial revolutions on a stationary bike is another good way to work on range of motion. Just take it to where you feel resistance and push a little bit, and then reverse into the opposite direction. As you get more range of motion, riding a stationary bike is a great way to just keep legs moving. Just make sure that you're not trying to get that full revolution at the expense of compensating your knee or your hip into abnormal positions. And then icing down is a great way to work on knee extension. Get something underneath the heel and some weight coming down at the distal end of your femur, just above your kneecap. And you want that low load, long duration stretch. So for more information, you can check out chrisbutlersportspt.com. Thanks.